aim is to give you some information about my experiences using the Cowden protocol. So until May last year, we had only single cases using this protocol, and due to the last ILS conference in Augsburg last year, we got the offer to get more experiences, and so it was possible to treat 20 patients for a 9-month trial. And today I want to present these results. Technik. Doesn't work. Okay. Some little technical problems. So the aim of this observational study was to integrate the Cowden protocol in our therapeutical concept, and so this was considering to the following aspects: getting more experience with other naturopathic protocols, observing the effectiveness of Cowden protocol in comparison to our experiences with other naturopathic concepts, monitoring the effectiveness of the protocol with a questionnaire before, during, and after treatment, and monitoring the effectiveness of the protocol with regular laboratory blood testings. So as Armin mentioned before, so we always did the serological testing, ELISA and Western blot, and additionally the ELISpot testing and the CD57 counts. Okay, we had some additional questions before starting the treatment. So, is the herbal protocol safe? Is the herbal protocol sufficient? Effects on co-infections, side effects, possible side effects. The length of treatment was also interested for us, and the occurrence of Herxheimer reactions as well. So you should know that we are treating now around 3,000 to 4,000 patients every year only with tick-borne diseases in Augsburg, and around 80 to 90% of the patients are treated with traditional medicine. That means the use of antibiotics, and we, in nearly all cases, we combine these antibiotics with additionally nutrition supplements, very often naturopathic remedies, just to avoid side effects or to support organ function, to detoxify and something like that. Around 10 to 20% got only naturopathic remedies due to different reasons, mainly because patients have a bad reaction like allergies on the use of antibiotics or other non-tolerances, or patient denied the use of antibiotics. That is always sometimes possible. Excuse me. Let me say some words about our clinic in Augsburg. So Dr. Schwarzbach and me, we founded the clinic in 2006. Now the clinic is running successfully since 6 years. We are specified on clinical diagnostic, laboratory medicine, and therapy and rehabilitation in patients with tick-borne diseases and other chronic infectious illnesses. So the treatment is based on a holistic concept, and so I would say 90%, minimum of 90% of the patient are Lyme patient, and 10% other chronic infectious diseases. So we also see patients only with chronic chlamydia infection and so on. Additionally to the consultation, and we offer patient a medical day clinic for intensive treatment, and all treatment is based on the guidelines of ILS and the guidelines of the German Borreliosis Society. All the medical services are done in a so-called medical partnership. So we are now 6 physicians in Augsburg, 2 of them in part-time, 3 in full-time. And all the other services, so rehabilitation and other treatment options, are done in the BCA clinic. All of the 6 doctors are now specialized for many years in the treatment of tick-borne diseases. And at the beginning, when we see patient in the first appointment, our aim is to get all needed information. So in doing comprehensive anamnesis, another problem are the differential diagnostics. So not all patients are suffering from Lyme disease. So as you know, Armin mentioned that we have a pre-selected group of patients. So many of them have Lyme, but not all. So it's always important to exclude by differential diagnostic other illnesses. That could be sometimes cancer disease, especially cancer of the blood, and other chronic, mostly inflammatory illnesses. That is also seen. We also offer dietary consultation and pain management in our clinic. So, that's also a fact, and very positive for patient and for our treating doctors, the good cooperation to our lab doc. So Armin Schwarzberg is very experienced in the lab testing, and so we are very close door by door, and that's really helpful to discuss some of the diagnostic results. And so it's a little bit easier for us to get this support in doing our treatment decisions and recommendations. So due to the mentioned kind of treatments, we always see that patients need additional treatments as well, and that is something I will figure out later on in the lecture. So due to our holistic concept, the treatment is mainly based on traditional medicine treatments, and as I mentioned before, we use very often integrative support. So that could be traditional Chinese medicine, that could be homeopathy or naturopathy as well. And the integrative treatment, so patients who start only using naturopathic remedies, so we always use mainly naturopathic remedy and treatments. Because due to our experience, we had seen that using naturopathic remedies in form of these tinctures and other therapeutical concepts have shown the best treatment results, and they are very close to the traditional medicine. There are some differences which I will figure out later on at the end of my presentation. And we have also done a lot of homeopathic treatment in the past, but that's very hard to compare these patients to each other. You know, homeopathy is a very individual medicine, and so very hard to comparable to each other. And due to our experience, we prefer the use of naturopathic treatment because we saw better treatment result as in using homeopathy medicine. Okay. When we start with our patients, the first which we do is the diagnostic, and Armin mentioned something about our questionnaires. We have different types of questionnaires. So first is a questionnaire to get all the needed informations about the medical anamnesis on history of the patients. We also check on possible chronic inflammation processes, and you have got the needed information about our co-infection list. That is also very helpful to get the needed information. After getting all these needed informations, we continue at the end of the first consultation to check the needed laboratory testing. So some of the patients have testings before, and we only completed the testings if needed. It makes no sense to make additionally ELISA or immunoblot testings if we got the needed information before. So very often we need also only additionally the ELISpot LTT or the CD57. That is a testing which is not offered in most of the labs in Germany or in other parts of Europe. But for us, very important tool to get really good information before starting treatment. Remember, all the case reports Armin mentioned is in his presentation. So additionally, we need some other examinations, so always a physical examination and some of the technical as well. So we always make ECGs. That is necessary only for the patient who got antibiotic trials. As you know, some of the antibiotics can cause a lot of side effects, especially the macrolides, like heart rhythm disturbances, and so we always check patient in the ECG just to get the needed information if we could start with such a treatment. In using other antibiotics, for example ceftriaxone, which can cause a lot of gastrointestinal problems, especially the building of gallstones or other biliary problems. We also check a patient in an ultrasound examination. Lung function is sometimes needed, not always. The same for spiroergometry or vascular Doppler examinations. Okay, so these medical anamnesis includes special types, so we need a lot of information. So, for example, the risk factors for tick-borne diseases, a travel history or anamnesis, social history, family history, history of current illnesses. All information are necessary to come later on a decision what kind of treatment is necessary. And the lab testing, I think Armin had explained enough about lab testing. That should not be a point of my presentation. We always recommend these physical examinations. So you should examine heart, chest, abdomen, and nearly all parts of the human body to get additional information. So very often only the occurrence of special skin signs could give you very important information of possible co-infection. So just before starting this presentation, there was a colleague from Norway showing me some pictures of a patient having these typical pseudo scratches, and that is had the same meaning as bullseye rash or erythema migrans, for example, to get possible information of for possible Bartonella infection. And so we always recommend to examine all patients before starting any treatment. The needed technical examination I explained before. Sometimes, especially in patients with very severe neurological problems, other examinations are also necessary. That could be MRI, or sometimes a SPECT could be very helpful. So even in patients who had pre-diagnosed MS or ALS, then those kind of examination makes sense and could be very useful for treatment decisions. That is an example for our extended anamnesis checklist. So that's a questionnaire including 15 pages. So we ask the patient to fill out these questionnaire. It needs some time, we know, but that is very helpful to get an overview of all possible affected parts of your organism. So there are some information about your the musculoskeletal problems, about neurological problems, about joints, as you see on the screen. And the co-infection list I do not have to explain. You got all information before from Armin. And according to Kenneth B. Singleton, a very experienced guy, a Lyme literature doctor from the States, we use this third questionnaire to get some information about possible additionally inflammatory processes. You know, most of the patients we see with chronic infectious diseases are suffering additionally on inflammatory processes, and so this information is also important just to do later on maybe a different treatment decisions. So we sometimes see patients who had still some problems, but really good, perfect development in the lab testing, and so that could be that some of these symptoms are caused by the inflammatory or inflammation processes, and so those patients do not need any more antibiotics, so then it's better to continue only with anti-inflammatory agents. Okay, we can do that also very quickly. So we always check every patient with Borrelia, ELISA, IgG, and IgM, always the ELISpot LTT CD57. Sometimes that was also mentioned by Armin, the Borrelia DNA PCA. We would prefer the multiplex PCR, which could be only done in United States. So there's no lab until now in Europe offering the multiplex PCR. So hopefully somewhere in the future we could also offer such additionally examination, because that is sometimes very helpful. The possible co-infection, bacterial co-infection, are here in Europe. Ehrlichia infection in around 20 to 30% of all seen patients. Bartonella had increasing numbers during the past 2 to 3 years. So until 2009, I always reported in my presentation Bartonella is not a problem. See, we always got in nearly 100% negative testings, and I told the attendees, so that's the main difference between Europe and the North American continent. But at the end of 2009, I built up a second treatment center in the north of Germany, and in this area there were a lot of patients having typical clinical signs for Bartonella infection. So I was 100% sure that most of them had a problem with Bartonella. So that was the region nearby Hanover, so the eastern parts of Germany, Saxon-Anhalt, Saxonia, and Thuringia as well. And so that was the first time to start this cooperation with IGeneX in America. And in many cases, we got confirmation of my suspicion. And these patients had big problems with Bartonella. And that is nowadays well proven. So in so-called field studies, we saw a lot of infected ticks. And we have now really increasing numbers. So in Germany, it was reported that around 30 to 35% of all ticks are now carrying Bartonella bacteria, and I think we should have been more focused on this problem as well. So rickettsia is a very common problem in the south of, so in the middle of Europe, especially in Switzerland, southern parts of Germany, and in France. There's a different stain, Rickettsia helvetica, which is present in the Lake Constance area, and should be also focused from patient on this area. So in other parts we see seldom problems with rickettsia. So chlamydia, Armin mentioned, in around 85% of all Lyme patients. Mycoplasma, I would say, in around 50 to 60%. So nearly all patients from the Scandinavian countries like Norway, Sweden, Finland, and Denmark have these additionally co-infections. And Yersinia is also sometimes seen. You should also check on other parasites, especially the protozoa infection like Babesia or other pyroplasma infection. That is also more and more common. You should know that these protozoa infections are mostly transmitted by different tick form that's transmitted by the Dermacentor tick, which is really more and more common here in the southern parts of Europe. So there was a movement during the last 10 years. These ticks are more common in the south of the Balkan region and now had moved to the northern parts of Europe as well. So there had been published some studies here, especially for Austria, that around 80 to 90% of the ticks are infected with Babesia infection. 80 to 90%, so it's around 2 years ago. And here in Austria, there are big problems with co-infection as well. Sometimes it makes sense also to check on viral infection. So the most common viruses are EBV, cytomegalovirus, virus, then the viruses of the herpes group. Coxsackie is also very common, sometimes Toxoplasma, and the other ones were mentioned very often in the past 2 years, but I think the meaning of XMRV is not so important nowadays. Okay, there could be some problems in treating viral infections. You know, that is a problem, especially in patients under traditional treatment using antibiotics. So we saw more intolerances due to antiviral medication as due to antibiotics. It's a little bit easier to treat a viral infection by using these herbal products. Some of them have really good efficiency and really fantastic tolerance, but the normal antiviral medication could cause a lot of liver problems. We very often saw dramatically increasing liver values in the past. Okay, you should always do a differential diagnosis. So very important could be to confirm or exclude rheumatic diseases by doing the Rheuma factor anti-CCP. You should be focused on autoimmune diseases. The best testing would be ENA, P-ANCA, and C-ANCA. Inflammation processes and toxicity. So we very often see multiple chemical sensitivity and heavy metal intoxication that could be influence the symptoms and complaints of many patients. And so if you would see not enough improvement only on the anti-infective treatment, you should always check on these other influences as well. And a very important part could be the endocrine dysfunction. Many of our patients have additionally hormonal problems, and so in different parts of the organism. That could be the thyroid gland, the pituitary, the adrenals are very often affected, and the sex hormones as well. So you should know that vitamin D could also be a big problem. So there was recently published a study showing that even healthy patients, so that's guilty for Germany, in around 90% have problems with their vitamin D levels. And so that's nowadays recommended from one of the nutritional from the Nutritional Society in Germany to substitute vitamin D. And we could confirm nearly in all patients having Lyme or other chronic illnesses these lacks of vitamin D. And so only the lack of vitamin D can cause muscle problems, for example, and sometimes very severe gastrointestinal problem. So I would always check on vitamin D. So now the needed information about treatment. So that's my side of view, our holistic model of treating a Lyme patient. So as you can see, so the basement is getting all the information by doing a specific anamnesis, by doing all the needed lab testings and examination. So that's the base of a stable house. And the columns of treatment are mainly the anti-infective treatment. That could be the use of integrative or alternative naturopathic remedy, for example. We always recommend a change of diet and change of lifestyle. If needed, supplementation and detoxification, also supporting of different organ function. So if we see any failings in the liver or kidney function, patient get always support. A very important column of treatment could be also the pain treatment. You know, more than 70% of all Lyme patients have chronic pain syndrome. Most of them neuropathic pain syndrome, and you should always support your patient in doing a good pain management. We also recommend an really old patient exercising therapy. That means training all of them, especially those patients who stay for some time in Augsburg in our clinic. They will start from the first day of treatment with exercising at the beginning on a very mild or moderate level, and later on we see nearly in all patients really good development, and week by week they are able to train a little bit more. And also important is a mental coaching and social support. You know, many of the patients have problems with acceptance by insurance companies or other healthcare providers. And so, if possible, you should support the patient as well. Okay. So let's talk about the Cowden support protocol. We started in June last year in 20 patients. And so, as you have heard in the first presentation from Lee himself, his protocol is based on a naturopathic treatment on a holistic approach, and they use mainly herbs from the South America region. The Cowden protocol is a multimodal approach, various herbs and ingredients included in the protocol. You have heard a lot about these ingredients, and so based mainly on anti-infective, that means fighting bacteria, viruses, and protozoa infection. Some of the herbs are responsible for the flush out or the detoxification, especially of heavy metals and others. And we also get support by using the Cowden protocol for possible hormone disbalances, sleeping disorders, and mood swings. Some of the herbs have really fantastic anti-inflammatory effects, and the pain relief is also very good in using the Cowden protocol. So mainly, most of the patient has been treated in United States. We know for a long time about Cowden protocol here in Europe, but it was not so common. And we were very happy in getting the offer last year to get more experiences with the protocol, and we were very excited to do this study. So 20 patients were included. All of them were treated continuously for 9 months. We were male 7 patients and 13 female patients. The median of the age was nearly 40. So the youngest patient included in this observational study was 15. The oldest one 53 years. All of the patients had confirmed diagnosed with chronic Lyme disease, and many of them had additionally co-infection. So the confirmation was doing by the mentioned lab testing. All of the patients had co-infection, mostly chlamydia. As you could see, 15 patients had problems with chlamydia pneumoniae, 13 with mycoplasma, 7 with Ehrlichia. Bartonella was also very common. Some of them had additionally Yersinia problem, 2 toxoplasma, and very often we could confirm some of the mentioned viral infection as EBV, cytomegalovirus, herpes group, and Coxsackie. It's also important to know that all of the patients had antibiotic trials before. When they started later on under the Cowden protocol. We did all the mentioned testings, so before, during, and at the end of the treatment. So especially the serological testings, a minimum was once per patient. The ELISpot testing every 3 months, and the same for CD57. In addition, we checked in some of the patients the normal lab testings, blood count, liver and kidney parameters, even to get needed information about influences on liver or kidney function. And all patients were asked to fill out a specific questionnaire about their health status every 3 months to get the needed information about the clinical development in using Cowden protocol. So 2 patients had to stop the treatment. 1 female patient aged 50 due to the diagnosis of acute cancer disease after 2 weeks. So it wasn't possible to continue the treatment because this patient had different cancer treatments needed. And 1 female patient quit. That was the youngest patient in the study, quit due to an acute psychosis after 5 months. And so the problem was that we didn't get any contact during this time, so it wasn't possible to continue the treatment, and this patient was excluded as well. So information about the tolerance of the protocol. So due to the questionnaire during the whole time of treatment, we got the following information. So 5 patients of 20 told us in their questionnaire the tolerance was very good, 10 patients good, 4 patients mentioned mild side effects, especially gastrointestinal side effects like a little bit nausea or abdominal pain, and 1 patient mentioned in his questionnaire a bad tolerance to Cumanda and Hortunia, but that was not a big problem, so we always react in reducing the dosages, and it was no problem to continue. And there were no patient who had bad tolerance or a patient in which we had to stop the treatment. So the results after 9 months showed in most of the patient improvement. So due to the questionnaire, 80% of the patient had improved. So it's a little bit curious. So due to the lab testing results, the results were even better. So 90% had shown a good development in the lab testing. So especially development in the CD57 counts and less or no activity in the ELISpot test. So 10%, that means 2 had significant improvement. So they get rid of all the problems and complaints. So one of them after 6 months, but he just for his own safety we continued 3 months longer. And there was another patient who lost completely all complaints and symptoms. 50% showed really moderate improvement, and only 20% mild improvements due to the treatment. The patient who had to stop the treatment were not included in this statistical statistics. Interesting are the numbers of Herxheimer reactions. So that is always a proof that patient react, so from my side of view, in a good manner due to the treatment. So Herxheimer reaction, I always thought is bad for the patient because they had additionally symptoms and complaints, but it's a good sign that the treatment is well reacting in patients. So nearly every second patient had Herxheimer reaction, but it was no problem to handle this. Some information about the improved symptoms. So that's a little bit a ranking. So most of the patient had really significant improvement for the chronic fatigue symptoms, especially good response on their chronic pain syndrome as well. So especially pain relief for their joint and muscle pain. Chest pain, that is a typical problem, especially in patients who have this additional problem with chlamydia. That is not so common for Borrelia infection. So this improvement has always seen in most of the patient. So most of the patient lost their headache, and we see good response on neuropathic pain and disorders as well. So as a sign for Bartonella infection, many of the patients lost their fever symptoms and fever chills. The night sweating also a typical symptom for Babesia and Bartonella infection had also improved in most of the patient. Sleeping disorder, that is sometimes a problem in patient. So as I mentioned, this is a little bit like a ranking of improvement. And anxiety, you should also know that is a typical symptom for Babesia and Bartonella infection. So if you see patient with very severe forms of anxiety, so there are different problems of sleep disorders. So patients who have problems to fall asleep due to anxiety, that is always a sign of possible clinical sign of a possible Babesia or Bartonella infection as well. And so the improvement for muscle twitches was also seen in most of the patient. So my conclusion. So the Cowden protocol has proven to be very efficient and successful. Overall, so I could say it's a very safe and tolerable kind of treatment for patients. And both patients who had to quit the treatment did so not because of the protocol, but due to other reasons. The main side effects included nausea, abdominal pain, and mild diarrhea were seen. All patients react with side effects react very well on reducing the dosages. So I mentioned this patient who had some severe problems at the beginning with Coumadin and Hotinia, and nearly every second patient showed Herxheimer reaction. And so Lee mentioned at the beginning in the first presentation how to react on these possible Herxheimer reaction. We did the same in the patient and see really good response on these additionally two sheets at the end of the protocol, you know. Okay, interesting for me was the additionally lab testing reports. So, so as I mentioned some sheets in some slides before, we had seen a better improvement even to the lab testings. Yeah. So so I'm convinced. So that is for me personally a very important marker. Yeah, because so there are only less influences and on clinical science, and so I had seen due to the use of the protocol that always or in most of the patient a good development, and that is really a plus point for Cowden, using Cowden protocol. So that was only a small study group, not representative, but the aim was to get first experience in the bigger group of patients. But I could say the effectiveness is also good against most of the common co-infection. It seems to be a lack of efficiency due to these specific intracellular bugs as Bartonella and Babesia. So Lee mentioned it before. So there are different strains of Bartonella known. That could be that are here some differences in Europe in comparison with the United States. So I think there should be done some discussion even to support the protocol, maybe using some additionally herbs, and I think that will be possible in the future. So the effects and tolerability of Cowden protocol combined with antibiotic treatment was definitely no problem. We had seen no contraindication, so it was a little bit curious because we got the information later on that 2 of the patients used antibiotic trials additionally to the Cowden protocol, and we never had any information when we start the study. So that is also a pro for using Cowden protocol. We have a lot of experience with other naturopathic remedies as well, so especially using the European herb of teasel, and there's really a big problem. So teasel and antibiotic do not like each other. Yeah? So we had seen a lot of problems. So we had the aim to get synergistic effects some years before, but had always seen a lot of problems using teasel together with antibiotics, and I do not recommend anymore to do this at the same time. But for Samento, for example, it's really no problem. So if patients have only mild improvement of antibiotics and no contraindications, it would be no problem to add Cowden additionally. Teasel is Cade. That is a very common herb here in Europe, or nearly everywhere. Yeah, it's not a real distal, but it looks very similar. And this herb is very efficient, or had a good anti-infectious potential, even to beat Borrelia bacteria. Okay, so. As I mentioned before, 2 patients had completely been symptom-free after 9 months, and the treatment wasn't discontinued in those cases. And so due to our experiences, I would recommend to treat patient always under naturopathic remedies a little bit longer. So we had done some comparisons between our traditional treated group, and so due to my own experience, that's not representative, so a 6 months trial with traditional antibiotics produces nearly the same results using for 1 year these naturopathic remedies, sometimes a little bit longer. So in general, between 2 and 3 times longer treatment times are needed. But in principle, they are also, the naturopathic remedy, also very efficient, and I have really no problems to recommend these integrative trials to our patients. The only point is that you have to inform your patient that they need a little bit more patience, yeah, and I think that's only a small problem. Okay, so that is what I mentioned now, and we always recommend in using naturopathic remedies a little longer treatment times. So I think that's all I have to report about my experiences using Cowden protocol, and so I'm convinced that we will continue due to our good experiences. Okay, thank you very much for your attendance.